All right. Hi, everybody. It's the top of the hour. We're going to go ahead and get started so everybody can get back to their dinner or maybe start their dinner a little bit earlier. So I'm going to go ahead and just kick us off with some housekeeping items. Good afternoon, everybody. My name is Paige Heitman, and welcome to the Scope at Night, a special edition of the Scope podcast. We're going to touch on just a couple of housekeeping items before we get started. First, this Zoom session will be recorded. We would like to know how everybody is, so please be sure that your name is accurate. If you need help with this, just reach out to us using the chat box feature. It's pretty easy. I'll be moderating the session with my Phelps Health marketing colleague, Hillary McCash. Looks like she's already said hi in the chat box. So be sure to reach out to us if you need any help at all tonight. We would love to see everybody's faces. If you feel comfortable doing so, go ahead and turn your video on. Please note that each of you are currently muted. If you have a question that pertains to the topic being discussed, go ahead and add it to the chat box and we'll try to get that question answered. You also can add comments in the chat box. One thing that I will note about the chat box is that you can send questions and comments to the whole group or just one person. We'd encourage you to send your comments to the whole group. However, because our topic this evening is STDs, if maybe you don't feel comfortable doing that, that's totally fine. You can send a private message and we'll make sure that we get that question answered for you. We do want to encourage everybody to utilize the reactions that Zoom offers during this discussion today. You can use a hand clap, thumbs up, thumbs down, etc., to let us know if you like, love, agree, or disagree with whatever we're discussing. Reactions can be found in two places, one either at the top or the bottom of your screen, and one that you'll see whenever you display the participant list. Also, if you're watching from our Facebook live stream, hello, feel free to ask questions, comment, or show us emoticons during the conversation. We will be conducting a few polls, and lucky everybody tonight, we're only doing one poll throughout this Zoom, so you'll get a chance to interact then if you choose. And of course, don't forget about the chat feature. Some of you might be using a mobile device, while others of you might be using a laptop or maybe a computer. If you find that your features aren't the same or you're having trouble with something, just make sure that you can participate with us however you can and however you feel comfortable. If you do have issues with your sound, the Zoom meeting, or any other features, use the chat box and one of our moderators will be happy to assist. So all of that being said, I'd like to go ahead and introduce our two guests tonight, Dr. Nathan Ratchford, Chief Medical Officer of Phelps Health Hospital and a gynecologist with the Phelps Health Medical Group. Hey, Dr. Ratchford. And then we've also got Dr. Cory Offutt. He is one of our primary care providers at Phelps Health as well. We're really excited to have both of you here. So just to kind of get us kicked off, today we are talking about STD, which is kind of a taboo topic, and we're super, super excited to have this conversation with everybody. So just to kick us off, what is an STD? Maybe Dr. Ratchford, I'll kick that one to you.
Sure. So actually the current nomenclature that we use for this is sexually transmitted infections. It was STDs whenever I was in training, and I don't know when that changed, but we currently call it sexually transmitted infections. But basically, these are typically bacterial or viral infections that are passed with sexual intercourse. As we're going to discuss, some of them don't have any symptoms, some do, some can cause other health concerns. So it's definitely, I know it's a sensitive topic to discuss, but it's definitely an important one.
Mm-hmm. Yeah, totally agree. Dr. Offutt, let's just move right along to question 2. What are some of the most common STDs and their risks?
So some of the most common STDs out there are going to be gonorrhea and chlamydia, are probably two of the more common. And then genital herpes is also one of the more common ones. And then I would say also HPV is a fairly common STD as well. And that all of them can be tested for, which we'll get into later. But they all have their own unique risks. Some are curable, some are not. Some cause fertility issues. Some of them can lead to certain types of cancers, like with HPV can lead to cervical cancer. And some of them are just extremely painful and can be spread more easily even whenever you don't have symptoms.
Mm-hmm. Yeah, absolutely. Dr. Ratchford, anything to add to that?
No, I think you covered it. Yeah.
Awesome. So question 3, I love asking this question because I have a sibling who gets cold sores pretty often. Are cold sores an STD?
So do you want to field that one, Dr. Ratchford, or do you want me to?
Well, I don't know. Paige, do you want us to alternate back and forth? Or are you going to call us? How do you want to do this?
Yeah, maybe let's just alternate back and forth. But if you guys have anything that maybe you want to add to whoever goes and answers that question, feel free.
Okay. Well, so cold sores are caused by an HSV virus, So historically, we've thought of HSV1 as an oral virus that is passed with skin-to-skin contact from one person to another. So we're talking about like kissing, for example. And then HSV2 historically was thought of to cause similar lesions as what people are familiar with when they see cold sores on the mouth, but in the genital area. Over time, that distinction has become less important. And to be frank, with modern sexual practices, with skin on skin contact to different parts of the body, you can get HSV1 or 2 in either of those areas. So I would give this question a solid yes and no. It is a sexually transmitted infection in that it can be passed with sexual intercourse, but it doesn't necessarily require intercourse. It's really that skin to skin contact.
Mm-hmm. So be careful when you're kissing is what I'm getting from that.
Yeah. So definitely when somebody has a cold sore, that's when they're most contagious. Their viral load is the highest, and the lesion that you see on their lips is where the virus is actually at. But even when somebody doesn't have an active herpes lesion, they can still be contagious. Their viral load is just a lot less. So, definitely if you're somebody who is prone to getting cold sores and you are intimate with somebody who does not get cold sores or has never been exposed to HSV, you would definitely want to avoid that skin on skin contact when you actually have an active lesion.
Great advice. Dr. Offutt, anything to add to that?
One thing to also keep in mind is that you don't always have to have the active lesion. Sometimes you'll start to actually have symptoms prior to the lesion showing up, and you are still very contagious during that period as well.
Mm-hmm. What are some of those symptoms that you're kind of talking about?
Well, every patient's kind of different. And so sometimes it can just be like a tingling sensation. Sometimes it can be a burning sensation. Sometimes it can even show up as like almost like what looks like a pimple on the lip to start with. And then it breaks out into the more of the cold sore that we all have pretty much seen on multiple people whenever we're just walking around.
Mm-hmm. Yeah, absolutely. Great information. So question 4, Dr. Offutt, this one's for you. How serious are STDs? Should someone be concerned if they have one? So let's say there's the person that has a cold sore and then maybe somebody who has something maybe a little bit more severe.
So like you alluded to, there's various STDs and some of them are quite serious and some of them are not as serious, but they can all have their long-term complications that can be more permanent. Some of them are more permanent and some of them are curable. So like whenever, like with the cold sores and the genital herpes, those are lifelong. There's no actual cure for those, even though you can treat the acute symptoms and get them to go away quicker. There's no actual cure for those. Now there are cures for gonorrhea, chlamydia, and things like that, but those can, if left untreated or gone for a longer enough period of time, can lead to infertility issues, pelvic inflammatory disease, and things like that. Whereas like HIV, which is much more serious, it has no cure, but it can be easily treated, and to where if you're on the proper medications, you can actually have a fairly normal long life with a normal life expectancy as well. So it just depends on the specific sexually transmitted disease that you're talking about, and whether you should be concerned or not. And so if you ever have any symptoms whatsoever, definitely need to talk to either your OBGYN or your primary care provider to get that evaluated and treated.
Yeah, absolutely. I think that's fantastic. So question number 5, Dr. Ratchford, how many people have STDs?
Oh, I meant to look this up and I forgot beforehand. So
I have it right in front of me, Dr. Ratchford.
I'm gonna have to
Go back to Dr.
punt to
Offutt.
Dr. Offutt for a specific number.
So actually in the United States, 1 in 5 people per CDC information actually has a sexually transmitted disease of some kind. So they're actually fairly common.
Yeah, absolutely. And people, you just don't realize it because it could be something really simple or maybe something a little bit more serious that has symptoms to it. So great information. I think that also kind of destigmatizes it as well because, more people have it than we think they do. So the next question, Dr. Ratchford, we're going to try to bat this one to you. Is it true that only people with a lot of sexual partners get STDs?
No, that is definitely not true. Certainly risky sexual behaviors make it more likely for somebody to have a sexually transmitted infection. So people that are exposed to more partners, if you're not using protection like condoms, for example, your risk of transmitting or acquiring an STD from somebody is definitely going to be higher. But honestly, it just takes one exposure to acquire an STD. So.
So definitely be careful. A couple of the things that I heard you mention in there that I think are important are protection is really important. So making sure that you have condoms, making sure that you're protected, maybe even having a conversation with somebody who you might be sexually active with, or even kissing might even be worth just asking them.
Sure. I see a lot of, as a gynecologist, I see a lot of adolescent women who frequently these are younger gals that have not had intercourse for the first time yet. And the way I phrase it is, I phrase it in terms of who they're sharing their body with. I frequently tell patients, who you share your body with can have health implications for basically the rest of your life. And, we've all been there. Relationships are, they can be tough sometimes. They can be interesting. And especially for teens, the hormones are going and it feels like a natural thing. It's something they want to pursue. But, that frank discussion about, the possible consequences from their actions, that's important for patients to hear. So.
Well, I agree. Dr. Offutt, were you going to say something too?
Yeah, and one thing that people really should keep in mind too is oral sex can also be easily transmitted, or it can easily transmit different STDs as well, including gonorrhea, chlamydia, and even genital herpes can be spread via oral sex as well. So even using protection or barrier contraception of some kind during oral sex is extremely important in preventing.
No, I think that's great advice. I think we have to continue to have these conversations. That way people, even if they're younger people, they feel comfortable having these types of conversations with their partner in whatever format, they choose. Question number 7, can a person have an STD and not know it? Dr. Offutt, will bet that to you.
So a lot of STDs are actually asymptomatic. So the most common asymptomatic STD that I could probably think of would probably be HPV. There's really no symptoms of HPV until something happens, and like if a woman develops like cervical cancer or something like that. So yes, you can have multiple STDs actually can be present without you having symptoms. And you like particularly in males, males a lot of times won't have any symptoms, whereas females are more likely to have symptoms of specifically certain ones, particularly gonorrhea and chlamydia are probably the two more common, well-known, but then there's also like trichomonas that has pretty significant symptoms that a lot of women will have, but men won't have any symptoms of.
What's the difference between men and women and their symptoms? Why is there a variance in that?
So it depends on their physiology. So women are constantly producing a lot more like cervical mucus, vaginal lubrication, things like that. And then women also are more prone to have like pain and burning with urination just because of anatomy with shorter urethras and stuff like that too.
Yeah, great information. All right, we're just going to move right along. Dr. Ratchford, can a person contract an STD from a tattoo or maybe even a body piercing?
Yeah, definitely you can. That's why it's important that if you're going to, seek out a piercing or a tattoo, you want to go to a reputable location that's using sterile and safe practices.
Yeah, I love hearing you say that because I'm somebody that has a couple of tattoos. And one of the things I think is really important to know is if they're opening up stuff, make sure it's in front of you so you know that it's fresh, it's clean, it's been sanitized. Don't let them do it in a back room where you don't know what's going on. Maybe all of it's just in a tub for all you know.
Yeah, I mean, to be honest with you, they're piercing the barrier that you have with your skin, and it'd be really no different than going to your doctor's office and them giving you a medicine or a vaccine of some kind. You would expect sterile precautions with that, and this would be no different.
Absolutely. Moving right along, question number 9, what are the symptoms of STDs? So Dr. Offutt, I know you've kind of already spoken about this and alluded to it a little bit, but let's talk just some more about what are some of those common symptoms that might prompt somebody to go and see their primary care provider.
Yeah. So going males versus females. So in males, pain and burning with urination, redness around the urethra, urethral discharge is fairly common in a lot of the STDs in males as well. If it's left untreated long enough, you can actually get testicular pain and swelling as well, leading to like epididymitis, which is a little bit harder to treat, but still very treatable depending on the STD that's causing it. And then with females, vaginal discharge, pain and burning with urination, sometimes vaginal bleeding, depending on the severity of the inflammation in the vagina as well. And then different vaginal odors also, depending on which STD it is.
So I'm going to butcher this whenever I ask these questions, but can you explain in more detail what epididymitis is?
So epididymitis is, so the epididymis is a small sac that sits on top of the testicle that kind of houses the sperm and things like that. And so, in the seminal fluid. And so basically the infection can get into the epididymis and cause inflammation and a lot of pain.
Yeah, that definitely sounds painful for sure. So question number 10, Dr. Ratchford, how soon might symptoms of an STD appear?
It's going to be several days to weeks or months, to be honest with you. My general advice to patients when they might be like in a new relationship, they may have a new partner is, if somebody does have a new partner, there really shouldn't be any stigma around getting checked. Depending on what the exposure was, or if there's some specific concern, there may be more testing they would have to do down the road. Because like some of the viral infections, like, hepatitis C or HIV, for example, they might not actually show up on a blood test for months. But, in general, if somebody had an exposure and they were concerned about something common, like we'd mentioned chlamydia and gonorrhea earlier, those are actually checked with DNA probes, which are extremely sensitive. You could test immediately for something like that, but somebody might not have symptoms for several days.
Yeah, great information. So it's really important, again, like you said, to proactively have those conversations before you enter into any type of, physical stuff. So question 11, Dr. Offutt, are most STDs treatable? And let's kind of dive into the details on that.
So treatable, some are, some aren't. Manageable, most are manageable, but they may not be curable. So like Dr. Ratchford had said, gonorrhea and chlamydia are both treatable and curable, whereas herpes, HIV are not curable, but they are manageable and can be suppressed with different medications to where you won't be able to detect the virus or have outbreaks of like herpes and things like that. There are actually now cures for hepatitis C, which is a huge breakthrough that's actually relatively recent. And by recent, I say in the last 10 to 15 years is recent in the medical field. Whereas now they're starting to hopefully find some potential cures for HIV as well. But there are medications that you can use to suppress like the herpes virus, to be able to suppress it to where you don't have frequent outbreaks and won't have such a high viral load to where you can spread it to others. Trichomonas is very treatable and curable. Trying to think of any others that are common that we see. Can you think of any others, Dr. Ratchford?
Well, I was going to say, syphilis isn't common anymore, but it's treatable as well. So
we're actually seeing more syphilis recently because penicillins aren't used as commonly anymore for like ear infections and strep and stuff anymore. And so people were incidentally getting treated with penicillins for a long time whenever amoxicillin was so readily prescribed and penicillin was so readily prescribed. And so people were just having their syphilis treated without knowing it because they may never have been symptomatic.
Well, again, to me, I'm like, that's a good reason to go in and see your primary care provider.
Yeah.
All right, question number 12. Do STDs cause infertility and which ones maybe cause it? What are the levels of infertility, Dr. Ratchford?
Yeah, so I can't speak for males, but for women, the big point is going to be untreated chlamydia and gonorrhea infections, especially if someone has an infection that leads to what's called pelvic inflammatory disease, or PID, which is basically where it's in an infected fluid collection involving the fallopian tubes. So it's the upper genital tract in a woman. And, the damage, the inflammation, the scarring that you can get from that can damage the fallopian tubes, which can lead to infertility.
All right, moving right along to question number 13. If someone has an STD and they're pregnant, how will the fetus be affected? Dr. Ratchford, we might bet that one to you.
I can speak to this one. So for,
I used to do obstetrics too.
Yeah. So for most women that are that acquire an STD during pregnancy, the overwhelming majority have a healthy, normal pregnancy. However, certain infections, especially the viral infections, can cause severe issues with pregnancy, especially if it's in the second trimester. It can cause things like fetal demise and birth defects and things like that. So part of routine care for obstetrical patients is actually to do an STD screen as part of the new OB visit. And then, definitely for somebody who's pregnant and is concerned that they might have been exposed, there's no harm at all in repeating that. So I would definitely encourage somebody to speak to their OB provider if that's a concern.
And kind of adding to that too, towards the end of pregnancy as well, if they've had a history of herpes and things like that too, going on prophylactic medicines to hopefully prevent an outbreak. Because if you have active lesions whenever you deliver vaginally, you can transmit it to baby. And I've actually seen somebody transmit herpes to a baby, and the baby ended up with herpes meningitis right after birth.
Wow, holy smoke. So we did have a question come through during that time that I think is kind of a good segue before we continue on with our questions. If someone has HPV, does that affect their ability to become pregnant, or does that affect the fetus at all?
Not directly, like what Dr. Offutt was talking about with herpes. If someone does have HPV that has caused them to have like an overwhelming burden of genital warts, that can cause an issue with like either blocking the birth canal, or if it's on their cervix, like with their cervix dilating, just the structural changes in their cervix. And then HPV can also cause abnormal cervical cells and even cervical cancer, like what Dr. Offutt had said earlier. And so, it's important for women that are pregnant to be up to date on their cervical screening, because if somebody had a cervical lesion like that, that could also cause issues with pregnancy.
Yeah, absolutely. Thanks so much for taking the time to answer that. So moving right along, when should someone visit a doctor if they're concerned that they might have an STD? Dr. Offutt, will bet that to you. I know you've already kind of talked about that.
As soon as possible, particularly with herpes. If you think you might have herpes, or even if you know you have a history of herpes and have a herpes outbreak, usually you have to start on the medications to reduce the outbreak within 48 hours of onset of symptoms. And that's even if you have like the pre-symptoms of like the tingling and things like that. You can actually get started on the medications then before, and hopefully even prevent the outbreak. I always recommend anybody that is sexually active to actually get routine screening if they're having more high risk behaviors. So if they're having multiple sexual partners, not using protection, things like that. Now, if you're in a monogamous relationship and you've had your testing at the start of your relationship and both of you are monogamous, that's perfectly fine to not get yearly testing at that point, or regular routine testing at that point. But if you're having multiple partners without protection and things like that, then I generally recommend routine screening.
Dr. Offutt, one of the questions that came in whenever you were kind of talking about regular screenings is how often should somebody who is sexually active with lots of different partners, how often should they go in and get screened? Whenever you say routinely, what do you mean?
So again, it depends on the behaviors and how many partners, how frequent, like you're changing partners, and things like that. And then if you have a partner that has come to you that said that they had a previous or had a positive test or something like if they came back and said, hey, I had chlamydia, I tested positive for chlamydia, obviously you should get in and get tested and treated appropriately. So it depends on the person. I've had some people come in every 6 months to get tested because they're having regular, frequent, different partners. And then I've had some people who will get tested just yearly.
Yeah, absolutely. Great information. So another question that I have before we move on is, let's say this person doesn't have like a PCP established. Can they just go into immediate care every time they want to get tested, or should they really establish primary care to kind of begin that process?
So I always recommend having a primary care, particularly anymore, especially with like all the COVID stuff and everything, because there were so many ERs and urgent cares and immediate cares just being overrun, and having 4 and 5, 6 hour waits at times, just because there weren't enough providers and nurses to manage the patient load. But then having that follow up for the repeat testing to make sure everything's cleared up is super important as well. And so that's where the primary care comes into play, or addressing any complications also, or even long-term suppression and management.
Yeah, that's great information. Thanks so much for answering that. So moving right along, Dr. Ratchford, question number 16, do primary care doctors automatically screen or test for STDs at an annual wellness appointment? And I know I batted this to you, but Dr. Offutt might actually be a better fit since he is a PCP.
Well, I'll be curious what he'll say, but I'll answer it too after.
So we ask about it at the annual wellness appointments, if any concerns for any STDs or anything like that, and if they're having any risky sexual behaviors. But otherwise, we don't routinely screen, other than just asking for it to see if we need to go ahead and do testing for it, or even recommend testing. Because all we can do is make recommendations. We can't actually make anybody do any particular screening.
Dr. Ratchford.
Yeah, I would agree. I think that asking about a patient's sexual behavior and kind of assessing those risk factors, that's just due diligence. But I don't think that a patient should automatically anticipate that when they go in for their regular yearly checkup, which may or may not involve a genital exam. It just kind of depends on their age and what's going on. But if they have an expectation that they're being tested for a sexually transmitted infection, they really need to come out and ask that to make sure that that's being done.
And I would say the only one that we probably routinely do would be the HPV testing, which is just general PAP guidelines and everything.
Great, fantastic. Thanks, guys. We'll move right along. Question number 17, are STD appointments with the doctor confidential? So Dr. Ratchford.
Yeah, I mean, every visit is confidential. Certainly, trying to get away from the stigma of talking about sexually transmitted infections. For anybody out there who's concerned about that, there is nothing that your doctor has not heard before. No one is going to be, talking about you or gossiping about this. I can tell you from my personal experience that if one of my patients I've known for years, if somebody who just came in off the street, if somebody came in requesting to be evaluated for a sexually transmitted infection or even talk about risk, that's part of my job. Someone should have confidence that they're going to be treated with respect, and it'll be a confidential discussion.
And I'll add to that too. Teenagers are probably one of the higher risk groups that are not likely to seek care, because a lot of teenagers won't have those safe home environments to be able to come to their parents, to come to the doctors. And even those visits are actually kept confidential. And if the teens decide that they don't want their parents to know about that visit, we actually can't divulge that information to the parents either, if the teen specifically requests us not to.
Yeah, that's fantastic. I think that's really great information and kind of a good resource to know about. So question number 18, let's say that somebody does want to come in, maybe they even just like walk in off the street. What should they expect if they need to get tested for an STD? What does that process look like?
So basically like a normal office visit, they will go through all the questions and everything else to figure out like what kind of risky behaviors they're having, what symptoms they're having, why they're concerned about potentially having an STD. If they've been told that they've been exposed to a specific STD, that kind of helps on some things, but then a lot of times they'll just want to be kind of globally tested for all of the more common STDs. So some of those would be a blood test, like with HIV and hepatitis. Some of those will be, most of them anymore can actually be a urine test, with the exception of the HPV testing. So with gonorrhea, chlamydia, and trichomonas, those can all be tested off of the urine. And so it just depends on what we're testing and kind of the depth of testing that we're doing.
Mm-hmm. So this next question, Dr. Ratchford, I think is a perfect segue. So what happens if a person tests positive for STD? Where does that discussion then lead to?
Well, kind of going back to what we've discussed before, I mean, it's really going to depend on what the STD is. If it's something common and treatable like chlamydia or gonorrhea, they should expect to have a prescription for some antibiotics that they're going to get. And then, there may be some follow-up discussion about, getting the partner or partners treated, that kind of thing. But if it's something like we've talked about HPV, for example, with pap smears, a lot of times those things require further testing to check for like abnormal cervical cells. Another thing that needs to be discussed is, if that person's contagious. So we've talked about, herpes lesions and how somebody might be contagious even if they don't have an active lesion. Well, there's medicine that people can take to suppress the recurrence of outbreaks of those lesions. It also makes it less likely for them to transmit the virus to a partner, for example. It really, there's really no one size fits all. It kind of depends on what the actual infection is and what the patient's, expected outcomes and what the relationship might be.
Mm-hmm. Absolutely. So Dr. Offutt, I'm going to bat this next question to you. I love this question. Why are STDs not something to be ashamed of?
Just because they're so common. And so people, I really wish would just get rid of the stigma. I mean, it's no different than any other disease that you can acquire. And there's just such a big stigma around them. But I mean, STDs are part of just human life in general. Like a large majority of the people out there are having sex or will have sex at some point in their life. And so 1 in 5 Americans, I mean, that's a pretty high amount of people that actually have an active STD, a lot of them which don't even know it. And so just getting rid of that stigma, we could easily reduce that number. And if people would just be more open and have a conversation with their partners about any STDs that they have, to where they can take the proper precautions to hopefully prevent that transmission, it would help significantly and allow people to get treated.
Mm-hmm. So
I think,
oh, go ahead.
I was just going to add too, I agree with everything Dr. Offutt just said. And I'd like to add that these infections, they don't care about your age or your gender or your sexual practices or your race or, anything that you could think of. These infections can really affect anyone. So again, I mean, stigma is the right word for it. We really need to get away from that.
Mm-hmm. No, I love that. So in the spirit of destigmatizing, these types of conversations, you guys have mentioned a few different times throughout the show tonight, risky behaviors. So let's define, what are those risky behaviors? Is it the type of sex that you're having? Is it just the frequency of partners? What do you mean whenever you say risky behaviors?
So one would just be not having that conversation with your partner. So if you are not having those conversations, you're not asking, hey, have you ever had any STDs or do you have any symptoms? That alone puts you at risk if you're not willing to have that conversation. And then frequent sexual partners, not using protection, things like that are all very high risk behaviors. Dr. Ratchford, do you have anything else to add on that? I mean, I guess that's kind of a very short answer.
No, I would agree with that. I mean, basically, it's the more partners you have not using protection, and it's a sad commentary, and there's actually been criminal cases with this. But there's people out there that have infections that intentionally have unprotected intercourse to get other people infected. So all these would fall under the umbrella of risky behaviors.
Absolutely. Thanks so much for answering that question. So we've got one more question before we kind of wrap up. how can someone avoid getting an STD? Because, people aren't going to avoid having sex, but what are some of the things that they can do that are preventative?
Basically avoid those risky behaviors. I mean, have those conversations, use condoms, use any kind of barrier contraception. I mean, the most definitive way would be to avoid sexual activity, but like you said, humans aren't going to do that. And so just basically keeping yourself as low risk as possible to reduce that risk of acquiring an STD.
And I would also add, if you are in a new relationship and you have a new partner, don't be afraid to get tested. It's not something that should be viewed as a negative thing to do. And it's not, pointing fingers or accusing your partner. I tell patients all the time, nobody's going to watch out after your health better than you. And, staying informed and getting testing appropriate like that, that's going to help protect you. So.
And I've even had partners actually come in together and have both of them have an appointment at the same time, just they can both get tested simultaneously.
I think that's fantastic. I think we should give out stickers for that. That's awesome.
Right.
I mean, I don't know what kind of sticker you give out, but I'm just throwing it out there. All right, guys.
That's something for marketing to work on.
Yes. Yeah, we'll get right on that. So we do have one polling question before we wrap up. Oh, let's see. Oh gosh, it looks like it may not let me launch the polling question. So sorry, everybody, we don't have a polling question today. So we will just go ahead and wrap up. We've already kind of discussed some of our participant questions throughout our show tonight. So we don't have any additional ones outside of the ones that we've already asked. So we'll just go ahead and say thank you so much to everyone for tuning into the Scope at Night. A huge thank you for Dr. Ratchford and Dr. Offutt for joining us today to kind of talk about this taboo topic. We do appreciate all of the insight that each of you have been able to share with our community. As a reminder, this show has been recorded and will be emailed to all participants. It also can be rewatched on our Facebook page and shared with family and friends who may have missed the show. If you like this show and would like to know more, check out our other episodes of The Scope on YouTube or visit phelpshealth.org. Have a great evening, everyone. Thanks so much.
Hey, Paige. Hey, sorry to interrupt your closing. I thought you might ask for like any additional thoughts before we finish, but we left out one really important thing earlier when we were talking about HPV, which is HPV vaccination.
Mm-hmm.
So male and female patients older than age 9, there has been vaccination in place for HPV since the late 2000s. And, definitely, I mean, I'm sure Dr. Offutt gets this more than I do, but unfortunately, vaccinations are kind of a political topic off and on. But, definitely HPV, in addition to everything that we've talked about so far, it's the type of infection that is preventable with a vaccination. So I would definitely encourage men and women to seek that out if it's appropriate. So sorry.
And if the HPV vaccine is actually given under the age of 14, then it's actually only a 2-dose series instead of a 3-dose series. Australia actually is interesting. They actually implemented it as one of the mandated vaccines, and they've almost completely eradicated cervical cancer in their entire country.
Yeah.
Wow, that's amazing.
So,
It looks like Hillary put HPV vaccination information in the chat for everybody. So feel free to grab that, to share that as well. Thank you so much for mentioning that. That's a great
sorry.
point.
Yeah, I was waiting for an opportunity to bring it up because we talked about HPV like several questions ago, and I'm like, oh, we should have said that. And
I never gave you the opportunity. I'm a terrible
It's okay.
host.
It's okay. Thanks, Paige.
Right. Thanks, everybody. Have a good evening.